Hey there, you already know what I want to talk about. I think you already also know that chemotherapy or radiotherapy alone, in a lot of instances, doesn't really heal or help cancer patients. Now, granted, there are, of course, instances where it does help and where it's even curative, but especially for advanced cancer patients, chemotherapy alone as a single therapeutic just doesn't work. And as you also already know from the thumbnail and title, today I want to take a look at specifically why that is. Why does single chemotherapy fail or single radiotherapy? And thus, consequently, also why it is essential to use more than one therapeutic and more than one, we call it here, vectors of healing. You know, there's these three hallmark papers, or these three papers that discuss the hallmarks of cancer. And in these three papers that came out over the last 25-ish years, the author describes kind of more or less universal hallmarks or key characteristics of cancer. And he names 14 of these hallmarks. Now, obviously, cancer having 14 hallmarks isn't a big problem if your cancer is already dying because of the one chemotherapeutic drug you're using. For a lot of cancer patients, that isn't the case. The one chemotherapeutic merely halts the cancer or slows it down or doesn't do anything at all because the cancer is resistant. That is because some of these 14 hallmarks feed into treatment resistance of the cancer, meaning that if we just use chemotherapeutics, or even worse, just a single chemotherapeutic, then the cancer will be able to circumvent this toxic effect from this one chemotherapeutic drug. If you use multiple chemotherapeutic drugs and supportive interventions like alkalization therapy, for example, then the cancer will have less ability and capacity to circumnavigate the therapeutic effect, or the killing effect in this case, of the chemotherapeutic drug. And one image I like for this very, very much and I want to share with you is the image of the Nile. So for example, here we have the Nile, we have a map of the Nile rather, of the Nile River Basin. And you can see here that the Nile consists of a central flow that, if you move from the sea upward, splits off a lot of feeding rivers, right? So a lot of rivers feed into the Nile, and an advanced cancer with its hallmarks, with its 14 hallmarks, is a bit like a river being fed from various streams. And if we now use a single chemotherapeutic drug, it's like damming one stream that feeds into the river. And that is obviously useless. The Nile will still flow even when we dam one of its feeding rivers. Obviously, if we don't erect other dams and dam others of these feeding rivers in the Nile, then we cannot expect the Nile to stop flowing and stop feeding into the Mediterranean all of its water, right? And it's kind of the same with cancer. If we just use one single chemotherapeutic drug, we can't really expect this one chemotherapeutic drug to stop an advanced cancer and all of its 14 hallmarks that enable it to adapt to an environment, even if it is toxic to it, right? So the importance here is to use more than just one single drug or one single intervention, and to use a whole plethora, or as we like to call it, a mosaic of interventions. Now you can see with the example of the Nile, of course, that if we dam all of the feeding rivers, the Nile will have much less water to carry into the Mediterranean. And if we transfer that analogy to cancer, if we block the ability of cancer to adapt to its environment, if we make it less surviving and less adaptable and less resistant to various forms of treatment, but also to the chemotherapeutic drugs you're using, then the cancer will obviously have a harder time to resist and will more preferentially die, meaning that you will preferentially be cured. Or at least, get a way longer and way better life with less pain, etc., etc., etc. So this is nice. Now, this doesn't mean that there isn't still the holy grail of cancer care, right? I'm talking here about damming all the kind of small rivulets and rivers that lead into the Nile, ergo kind of cut off all the 14 hallmarks of cancer to make cancer go away, which theoretically can be done. Practically, perhaps is a lot more difficult than it sounds in this analogy. Although, damming all of the rivers that feed into the Nile is also quite difficult. So I think the analogy fits there. Of course, the Holy Grail is just to build one dam, to have a singular treatment, a singular drug, whatever, a singular intervention that just dams the entire Nile, that just removes cancer, done. You give it once to the patient, the cancer is gone, finished. A cure, a single cure. Now, mind you, I don't think we'll get there anytime soon. There's a lot of research into it. There's a lot of research that has gone into understanding cancer and understanding, its hallmarks, how it behaves, how it adapts over time, how it changes, why it does what it does, how it does what it does. And there doesn't seem to be a kind of central characteristic that is equivalent or the exact same across cancers. So this might be a bit confusing because I just told you about, the 14 hallmarks of cancers that are consistent across cancers. The hallmarks of cancer are categories of behavior or phenotypes of cancer that don't necessarily all rely on the same underlying mechanisms. So, for example, you can achieve the same hallmark of cancer in various ways. One example is immune evasion. If you, as a cancer, want to evade the immune system, you have a plethora of options. And it's the same with all the 14 hallmarks. And this means that it's probably best not to rely on perhaps a researcher at some point finding the singular cure for cancer, but to just use a mosaic of interventions, a plethora of different mutually supportive interventions against cancer that stack together to heal cancer and to heal the patient of cancer so that the patient can live a longer and better life instead of just dying of cancer because we just built one dam. I hope this has been an interesting perspective for you. If you need advice, you can go to 𝗥𝗲𝗳𝗲𝗲𝗀. We write articles, we have an entire written mosaic method, and we give an advisory service. Obviously, at least I don't think you need advisory service to do these things, to use multiple attack points against cancer. You can do that on your own. It's obviously a bit difficult because a lot of the information about these supportive interventions is still very technical. They haven't been communicated a lot to the public, which is kind of why we do what we do. But you certainly can do it on your own. I just, wanted to mention that we can help you with that if you are wanting help. With that all said, I wish you a very best day and see you next time. Cheers.